Today our presentation is on pancytopenia in a patient who is asymptomatic or in a healthy individual. This is not a common problem, but the pancytopenia is a very dangerous condition. If it is encountered in a healthy individual or the one who is having no symptoms, this sounds very hard because this can reflect some serious illnesses in the form of infiltrative disorders of the bone marrow, the primary diseases of the bone marrow, and some drugs. Even the acute infections can lead to the pancytopenia. So pancytopenia in an apparently healthy individual must be interpreted with caution, because the pancytopenia is often symptomatic. If it is seen in asymptomatic normal individuals, this must be cautiously interpreted because that can lead to the unnecessary investigations and serious complications that may result from these investigations. So there are some causes for the pancytopenia in an asymptomatic patient. So the first cause and the common cause which can be seen in patients with pancytopenia is actually the clot formation in the sample. There may be a big clot in the sample because of many reasons, which sequesters all the blood elements, the RBC, WBC, and the platelet count, the platelets, which are sequestered in this big clot, and the part which is left in the form of some liquid having few RBCs, WBCs, and platelets is taken for test. So of course, if the major elements have been sequestered, their number is markedly reduced in the sample which is tested for their number. So this can be one important cause and must be interpreted and must be communicated with the hematologist, and the sample may be reviewed. Multiple clots may also lead to the pancytopenia in a healthy individual, apart from this big clot. This is the most common cause which can cause serious concern over the pancytopenia in normal individual. The second thing is, for example, if a patient has presented with some acute illness, for example, just like acute vomiting or diarrhea, just because of a clear-cut reason, just like food poisoning, and his blood CP is sent, and this reveals pancytopenia. So the common abnormality or the common problem which can be seen in such patient is the blood sample which is taken is actually, for example, if this is the forearm and there is the cannula which is which has been inserted for the transfusion of the fluid. So the sample has been taken from the same side, and it is proximal to the insertion of the cannula. For example, if it has been taken here or here or here. So this can lead to dilution of all the elements in the form of RBCs, WBCs, and platelets, giving us spurious results as pancytopenia in healthy individuals. The third common cause which can be encountered is actually the exchange of the samples. For example, someone's sample has been sent which is healthy, is exchanged with a patient who is suffering from some neoplastic or infiltrative process in the bone marrow. So exchange of the sample can lead to the spurious results of pancytopenia. There are other two important causes which are not common, they are very rare, but that can be kept in mind while dealing with pancytopenia in a patient who is asymptomatic. So that is actually the sample has been infused with normal saline or some other fluid for dilution by the patient or by the attendant for other reasons. There may be many reasons where the blood sample which is taken by the staff and is given to the attendant or the patient to take it to the laboratory for test and is infused normal saline or some other fluid for dilution that can give rise to the pancytopenia for some reasons. The fifth one, this is not common. This is again a very rare cause of the pancytopenia in a healthy asymptomatic individual. Symptoms are usually expressed by the patient. If the patient is not willing to tell you about the symptoms, or if the patient is concealing the symptoms because of many reasons, because of job security, because of family concern, because of some other reasons. If the patient is not willing to tell you about his symptoms, for example, if the patient is not willing to tell you about his fatigue, if the patient is not willing to tell you about the exertional dyspnea, if the patient is not willing to tell you about the headache, if the patient is not willing to tell you about the epistaxis he experiences, and if the patient is not willing to tell you about the repeated infection in the chest, the gut, so you can't pick that from the clinical examination. Headache, fatigue, exertional dyspnea, body aches, lack of energy, that cannot be appreciable from the clinical examination. So these are the three common clots. This is dilution, exchange, and fusion of fluid, and concealment of the symptoms by the patient for many reasons. Hope this is very helpful in those who have pancytopenia and are apparently healthy. Thank you very much.